waiting list. How can Carol expect to see that woman?
So there's a couple of things. One is we're going to introduce a single point of access for all non-urgent referrals to gynecology and women's health services to speed up better access to treatment, because a lot of women will be experiencing pain, discomfort. They wouldn't necessarily always qualify in the sort of technical clinical definition as urgent, but if you're in pain it feels urgent.
Of course.
I think we all can identify with that. So that will help. And then also redesigning, as I was just describing, the clinical pathways in the most common conditions like heavy periods, menopause and urogynecology. So through both of those things, we should be speeding up access to an expert, to a consultant. And the final thing is when we launch NHS Online next year, which is going to be our new online trust that will give faster access through online consultations with consultants, among the very first conditions going on there will be gynecology. So all of these things are going to help in terms of women's health.
But I would imagine there's a lot of women thinking, hang on, the gynecological issue that I have, how is that going to be treated using digital GP or a virtual hospital? These things are generally very hands-on.
Yeah, and that's why it's very much about speeding up. Because when I think about how do I get people seen faster and how do I turn this NHS around, it's trying to get every bit of the patient journey done as fast as possible. So everyone will initially kind of have that face-to-face consultation with someone, and obviously it will vary depending on your symptoms, but if a woman can be seen faster face-to-face through a specialist online, they may well require physical examination following that consultation as they would any other consultation in person. They will then be referred to a local provider who will then do that in-person examination. The crucial thing though is, because of the way NHS Online will be set up, it's very likely that first initial appointment will have taken place faster. So her access to the next stage will, by definition, be quicker.
Let's talk about endometriosis. Huge topic. We've covered it many times on this programme. I want you to listen to Zoe Trafford. She has had endometriosis since she was a teenager. She first spoke to the BBC in 2022. 4 years on, she's had her womb and part of her bowel removed. She's had to give up her job as a hairdresser. She spoke to the BBC's health correspondent, Catherine Burns.
4 years on, I'm not in the best health. I can't work, I can't stand, I can't sit. I live with chronic pain, and since all the surgeries,